Okay, we'll start from the least to the increasing order, like ascending order. This is MIC device, magnetic induction device. As a home care use, you can give for oral mucositis in cancer. You can give anything. Anybody said anything? No, no. Okay, I thought I heard something. So what you can do is, if you want a blue wavelength, you can. If you want the red, this is LED based. This is not laser based. That's why I can see it. Okay, and this is a combination combo currents. It's a patented technology. This is a patented technology, no less. So you can have do this and the question modification and education, or having that wow effect in your clinic. Whenever the patient is sitting at the reception table, you make him sit it for 5 minutes and then remove it. So by the time some cells will be primed for whatever the surgeries, whatever the you have planned for, right? Because you can't make the patient sit on the dental chair and do, because you'll be having so many patients waiting. So आप रिसेप्शन में जब पेशेंट बैठते हैं तो आप उसको लगा के बिठा सकते हो. Pre PBM is especially done to make the cells ready for the assault or injury whatever you are going to do it, right? Post PBM again you are augmenting that effect. You are going to help further once the tissue injuries has already occurred. Sometimes at your home a small child kid falls, comes with bruises or anything, you can have any of the lasers and directly place it on the injury. Actually, I didn't have enough time to show, because I could have shown that the patient, when they had fell down, they had the lacerations. The one patient was sutured, the other patient was not sutured, and results were very, there no scar formation in laser group. So you can try it at your home also for any pain, any finger pain, anything, neck pain, TMJ pain, ulcers. I had this machine the other day, one day before coming when I was in hotel. I was not able to articulate the words properly because I had a lateral border of the tongue slight ulcer developed. So what I did, Amit knows what I did. So it will started now. Lateral border of the tongue. I did it like this for 1 minute, and to my surprise also, next day I was quite okay. So you must have that belief, that understand, that empathy, that compassion towards the patients. When you are treating a patient, right? Think that you have got all the powers, that healing potential powers in you, and that you, when you are going to put this, I am healing this patient. Go with the firm belief that you are healing the tissues, and then see the changes. This is I have acquired over 4 years of experience. पेशेंट थोड़े इसमें हाथ में कभी भी ठीक होते नहीं है, और हमारे इसमें एक दो दिन में होते, बिकॉज आई एम नॉट डूइंग एनी, मेरे पास कोई ऊपर के पावर नहीं आए हैं. आई जस्ट कंटिन्यू द फर्म बिलीव दैट आई हैव द पावर्स, राइट? So whenever for quick this one I use this, or I have to go to the dental clinic, take this and then start. Every time if you, even if I have this at home, इसके एक्सटर्नल पावर सोर्स लगा के करने में थोड़ा मुझे, so I find it very handy for healing the lesions. Only healing, only one wavelength it is. You will tell me which one is this. 640 to 660, because it is visible, right? Visible. So this comes in visible range 640 to 660. So whenever the lesions are superficial, the best. If you don't have this, if you're 8 and 10, don't think that you're handicapped. You don't have any 660 or 640. You can still have the same, almost same. Suppose this is amoxicillin drug of choice for some diseases. Even if you use something other than this, erythromycin or any other, but not to the degree of expectation what you wanted with amoxicillin. The drug of choice is this. In 8 and 10, you can still do wonders. Start lasing, it's amazing. So now what I was using was a single probe, 8 and 10. If I on this, let me keep it in the visible range, so that to make a, no, no, yeah. Give me water. So if I start this in, can you all see the red button here? It is on now. रेड लाइट दिख रहा है? अभी नहीं दिखेगा. नहीं, सॉरी. अभी नहीं दिखेगा because it is 8 and 10 started, right? So रेड बटन दबाया. No, something has happened for this. Uh, Amit, मेरे तो करे. Hold. It started. See. Hmm? So this comes in the visible range. That's the reason you are seeing the light. If अभी अब लीजन आपका ज्यादा है, लीजन आपका ज्यादा है और आपके पास वक्त कम है, या आपके पास वक्त है लेकिन आप जल्दी से करना चाहते हो, oral submucous fibrosis या जो any larger lesions, any trauma cases in oral surgery, I do get enough trauma cases. What I will do, you can have this for hair regeneration also. We have that option here. Can you see? No knee, no hair, combo wave. Now many people will be interested. Hair regeneration. Yeah. So what we usually tell the clients to have a one derma uh, that comb, and then spray some minoxidil, and then do lasers. So now I'm in no knee. No knee means it is comes in infrared region because it has to penetrate deeper into the knees or here deeper. So you will not see. Can you see the red lights here? Don't see it for the longer period. Can you see the red periphery? So we have 5 minutes, 10 minutes, and 15 minutes depending upon the area. So now I will keep it in no hair. That is only superficial I want. Now you are in the 640 to 660 region. That is visible. You'll see the lights now. Exactly. Everything is external. You can't keep this internal. It not PBM. Yes. You can do PDT also. Actually, we had a case from medical college where there is a diabetic foot ulcer, and they had suggested for a plastic surgery for that. So the patient was somehow referred to me. What we did was put the dye there, and then we irradiated it with combo. I will send you the result on the WhatsApp group of that case. So you can take this and visit surgical clinics, medical doctors with some make on 10 files of the articles and show it to the doctor that what I'm going to do, what does this literature says, how you're going to use the laser. Let me do it free for 1 or 2 patients. You see the results. Then you can do. You can. There is a learning curve, and the patient doctors, especially medical doctors, they think that they know everything. You have to make that unlearning of whatever he has learned and show him the results of 1 or 2 patients. Then he will be convinced to call you, right? Pick up your niche. आप क्या करना चाहते हो? टीथ व्हाइटनिंग करना चाहते हो तो वहाँ वहाँ पे भी आप यू कैन अर्न इनफ मनी. एवरी वीक अगर एक भी केस कर दिए तो 4 वीक में आपको अगर 10-10 हज़ार या 8-8 हज़ार या जो भी आप रेट कर रहे हो उसके हिसाब से इंटू 4 करके आप देख लीजिए कितना आपको रेवेन्यू जनरेशन होगा. बट डोंट लूज हार्ट कि मेरे पास पेशेंट नहीं आ रहे. पेशेंट आने के लिए आपको पहले क्लाइंट बिल्डअप करना पड़ता है. एक 4-5 पेशेंट आप फ्री करते तो आपका कोई नुकसान नहीं होने वाला. जस्ट ए रे ऑफ लाइट, राइट? You show them the results, they will be convinced. This is from the Elixon microchip जो भी conductor है, that is from Europe. We have got European certification. So you can't compare this with the Chinese laser and say that sir वो लोग 2 लाख में दे रहे हैं, आप 2.5 लाख में क्यों दे रहे हो? वो 1.5 लाख में देने के लिए तैयार है, उसका 10 वैट है. Please don't come up with such questions and queries because we feel insulted because you also don't know what exactly. You just know that it is 8 and 10 nanometer and they are giving at the shorter price and why I'm charging little more. Because Alexa was a good question because it we have a European certification which is very difficult to procure. European certification are very difficult to procure, right? So we have that certification. That's why We have to procure that from abroad and then assemble other things in India. Because if you go for any government dental college, they ask for the GEM portal nowadays. If you're in the GEM, then only we are eligible to buy. We can't. They can't take imported things. They have to be made in India. All over India, they have made it a compulsory compulsion now. So we have GEM portal of gold, single wavelength, triple wavelength. Because it was 6 months recently introduced, we have applied for it. It may take little some more time for triple wavelength. No, we this as a customer loyalty, we sell only those persons who have bought the knowledge lasers. FDA, exactly. FDA approved. Or exactly. You can just imagine, ma'am, when it can be used on the heart and others important, why not on the oral tissues? Right. It can be used and in it is ready to use. Yeah. Shelf life is 2 months, 3 months. No, no methylene blue. Actually, what you are seeing is chitosan induced indocin green. We have two types: plain indocin and chitosan induced indocin. Same with the methylene blue. We have plain methylene and chitosan induced because we are completely eliminating the plain this one because of its superficial beneficial effects. Of it is used across pharmaceutical industry chitosans because it is a better viability, exactly, better get. That's why we're using now chitosis. This has got 3 years. Yeah. And methylene blue also we have come up with now chitosan induced. W- it's your no, we have a link on web WhatsApp. You have to go there, click that order, and we'll dispatch it immediately. So you need not have to call because there are thousands of customers. They need not have to call us every time. They just go and order, they will pay, and it will be dispatched. And we have talks with the courier system as well. If anything happens at all to your laser machine, we give a promise of getting this back to your on the table within 8 days of within 8 working days. So warranty is 2 years. Yeah, you can buy extended warranty also by paying little extra, because usually what happens in dental setup, there will be 9 pages and 7 staff. So it will be changing hands every now and then between the staff and between the students. So it is better to be on the safer side, pay some more money and have an extended year warranty. Actually, I have to check whether we have it now. The dental institutions especially, we don't have any issues with the private clinician. How many patients are you going to do per day, sir? How many number of patients you are going to do per day? Exactly. It will, if you are using 5 to 7 patients per day, take it for 5 years. Nothing is going to happen the shelf life, right? And if you're using it for 1 or 2 patients per day, you can calculate on that. So now I put in the combo wave. So simultaneously combo currents, this is a patented technology, nobody can copy it from us. Both 6, 6, 10 are 8 and 10 is a battery. So just imagine when you irradiate if this is the any large zone, that is going to create an island of photons in that. So just imagine how fast the clinical beneficial results you are going to see within a very short period of time. So this is known as array. Those who want to build up on your practice, those who want to, especially oral surgeons, we educate in surgical hospitals, hospital setup, we educate this laser knowledge array. You can start your own laser dental clinic also. And no? You have the first mover advantage मैम. ऐसा ओपन करो जल्दी और मार्केटिंग स्टार्ट कर दो. पूरा सिटी में पता चलना चाहिए कि आपने स्टार्ट किया है बोल के. आई डोंट हैव एनी प्रॉब्लम. डेफिनेटली मैम, नो प्रॉब्लम. You will call, she will call again only for 8 to 10 patients. Afterwards, you will pick up, ma'am. You will learn how to. Yeah, exactly. I'm threatened now. I will charge more now. Yagal sir showed that chart. No, one patient you can earn $3,000. I have to apply that principle now. Now coming with this is over. Now this is uh, sir is not there. HOD sir. No, no. Just I asked. He's not there. No, because no. No, why I'm differentiating between these two lasers is some great person in DCI has told to have 8 watts or more. So whenever that specification comes to dental college, we usually sell this 980 plus 640. So we can't give a 8 watts in 8 and 10 watts machine. So just to abide by the guidelines by the DCI, we if they want, because most of the colleges like Rajeshwari, Oxford, GDC, and now Gaikwad sir has asked GDC Mumbai. He said that I am not worried about the DCI and nobody is going to pick up this machine. See it. You need a good laser machine. So in such cases, we do go for it because you can do PBM, PDT, and surgery, right? Here also you can do everything. Again, not the drug of choice for PDT, but still you can have achieve the results. Right? 980 and 650. So anywhere in that optical zone you have 640 to 660 nanometer. Not much of a variations will be there, hardly 10 nanometers. So this is for DCI, more than 8 watts. So who is there? Calling. बुलाइए. एक मिनट पॉज. नहीं तो कैमरा दूसरी तरफ ले लीजिए. So there are, whenever the TMD disorders are there, if the patient is in extreme pain, you can guarantee, not initially, after 4 to 5 patients, you can guarantee with fair degree of accuracy that एक sitting में आपका pain कम कर दूंगा, right? Because everyone will start their laser dentistry with little bit of apprehension, unless and until you get that confidence, then your body language and your way of speaking also changes, right? So initially, what you do, there are three ways. This is the one way, from here to like this. Where to get it? First, I will do extra orally. Yesterday, I taught directly go there and with the pecking motion on the skin. Can I get the bulb of this red, Amit? Yeah. Because this must not get damaged on the skull. I'm using this. So suppose think that I have started the laser now. It is started. Just because I must not damage that glass, put it on the skin like this, and then with a pecking motion like this, you have to keep on doing it for 1 minute, right? Can you see there? So once you do this 1 minute, then you can approach the same joint through intra-auriculary. So suppose you put this like this, right? Don't put it like this. It must be towards the joint like this, because you have to reach this joint, right? Go through the auricular like this and put it towards the joint. You tell the patient to open the mouth so that you will have better access into the joint. Put it in the auricular. Put your little finger in your ears. Open it. Can you see that movement? So for that moment, that joint you have to do it for 1 minute. This is second. Third one is, tell the patient to open his mouth and then go here. Start it. Start. Start. Ah, here. Here spend little 30 seconds more because it is little farther from the joint. Right. 3 minutes over, one cycle over. Again repeat the cycle of extraoral, intraauricular, and again intraoral. 1 minute, 1 minute, 1 minute. 2 cycles. And call the patient on the next day. Ask him. He says, "I'm having, wow, there is no pain. I slept nicely." Even if you want to, whenever you want to calm the patients, no. Yesterday. Yeah, she didn't take your number, ma'am. Just call her and take one casual. This one, how she's feeling. One more. What I was trying to tell you, very important was I forgot. Points. Shenman, we have these auricular points. Whenever the patient, he doesn't tell you the exact what his social or family problems are, you have to ask him little emphatically that आपके घर में कुछ प्रॉब्लम है क्या, कुछ कॉजे रिसेंटली ऐसे कुछ किसी का डेथ हुआ क्या, ऐसे आप अपने क्वेश्चंस फ्रेम करके बात करके आंसर्स निकालने की कोशिश करो. व्हेन यूर द पेशेंट इन एग्जाम हैज गॉट sleepless nights or if he's in tension, no, you can calm, you can from sympathetic to parasympathetic कैसा लेके आना है. One is I will share the or that image. One is here middle, one third, the depression what you see here. I don't have a ear here, so this depression here, 1, 2 and 3 here. एक एक मिनट करो. अगेन रिपीट वन साइकिल. पेशेंट को नेक्स्ट डे अब बोलो मत कि आपको बहुत अच्छा नींद आएगा, ऐसे कुछ होगा. वो कल आके मुझको बताना आपकी कैसे फील कर रही थी, इतना बताओ. नींद के बारे में कुछ बात करने मत जाओ इनिशियली, बिकॉज यू हैव टू गेन द कॉन्फिडेंस, राइट. नेक्स्ट डे जब पेशेंट आएगा, आप कल अच्छी तरह से सोए क्या, पेशेंट का रिएक्शन, सर मुझे बहुत दिनों के बाद पहली बार नींद आई, बहुत अच्छी नींद. दैट इज कॉल्ड लेजर एक्यूप्रेशर. Ma'am showed, no, ma'am also showed 5 points for yes. There are so many acupressure points. I will full share the article. You can go there and start for severe gag reflex. No, these 3 points are there: one, two, and three. Do these 3 points and take the impression. The patient will be having more than. Yeah, I will share the article. Tobacco cessations. What madam told exactly, I don't know. 5 points. It is, just type tobacco cessation, Puja ya Ugal article. No, you have that souvenir. Great. You can reduce the anxiety. Yeah, any type of anxiety and stress, you can try this. Whenever you're sitting alone in the clinic, you can try on yourself also. This will alleviate the pain, but the etiological factor you have to subsequently do it. It is not a panacea for all your ills. Like unless and until you are trying to treat the etiology, for the meantime you are going to reduce all this. Yeah, uh, whatever the for anxiety, whatever the pharmaceutical drugs you want to give, that you can do this only. Okay, let's start with the mandible, goat mandible. How many of your vegetarians here? One, two. You don't have any choice, ma'am. You have to work on the goat mandible because some people can't stand the sight of that goat mandible. You made it. They have to be targeted. Not easy, not easy. When you take any non-vegetarian, non-veg eating person to that shop, they'll stop eating non-veg. Challenge, open challenge. Now welcome the our patients. Actually, this is not the right way to cut. I have started getting the reactions. देख, ये लो पकड़ो हैंड्स ऑन करो. Actually, this slice of the tongue, mandible, and then show it. Though, who wants to try? Close. Ask. Mostly everyone wants one. Amit, everyone has there. Everyone has there. So fast there. ಹೇಳ್ರಿ ಇಬ್ರು ಮೂರು ಮಾಡ್ರೆ ಭಾಳ ಆತು ನೋಡ್ರಿ. He's telling we'll give it for all the 5 persons. I said only hardly 2 or 3 will do it. This is difficult. Che, 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 che. Where everything on?